Hi, folks. Welcome to another health talk from Marz. It's out of this world. Today's episode, we're going to be covering Alzheimer's disease and dementia, what you can do to prevent it, and what you can do to diagnose the possibility of getting it. So stay tuned. So Alzheimer's disease currently affects 7 million Americans, and by the year 2050, that rate is supposed to double up to 14 million people. We currently spend about $1/3 trillion on Alzheimer's care, and it's expected by 2050 that we will be spending close to $1 trillion. That's crazy. So I think we need to do everything we can to accurately diagnose and to take preventive measures that will keep people as they age from developing this very debilitating disease. So what is Alzheimer's disease? Alzheimer's disease is simply a neuro-degenerative disease of the brain that causes what's called neurofibrillary tangles. Neurofibrillary tangles are cross links of molecules in the brain that keep neurons from making their proper connections. So when people can't remember things, when people forget where they are, what day it is, all has to do with these delicate connections in your brain. Remember, the brain is composed of about 70% fat. So we're all fatheads. And the fat that goes into your brain is dependent on the type of fat that you eat in your diet. So let's talk a little bit about diagnosing Alzheimer's disease and differentiating that from just regular dementia. So Alzheimer's disease is the most common form of dementia. However, almost all the time, Alzheimer's disease has a cardiovascular component. So it's really critical that we evaluate cardiovascular systems way in advance. So right now, cardiovascular disease is number one in terms of killer in the United States. Cancer is number two. And really accurate estimates are Alzheimer's disease is number three because it's grossly underdiagnosed on death certificates. So we got to keep that into consideration. All right. So what are the factors, aside from genetics, that trigger people to develop Alzheimer's disease? Well, we know that the brain, which is composed of 70% fat, is very susceptible to oxidation. So oxidation takes place when there are certain toxicants that trigger free radicals to be produced. So fats in the brain can become oxidized when there are high levels of, for example, mercury. So mercury is something that we're constantly being exposed to, and yet no physician really pays any attention to looking at tissue levels of mercury. So let's talk a little bit about diagnosis of heavy metal toxicity. For one, looking in the bloodstream is only going to show you an acute exposure to these heavy metals. The four big heavy metals that we look for are mercury, lead, cadmium, and arsenic. So those are the big ones. There's other metals as well that can affect the brain, such as aluminum, thallium, uranium is something that we're all exposed to, small amounts. So we want to be clear in, okay, how do we measure these heavy metals? So the best way that I am aware of to measure these heavy metals is to actually stir the pot up. So what do I mean by that? Stirring the pot means to take in a chelating agent and then collecting a certain amount of urine for a period of 6 hours. So let's use an analogy. Here in Portland, we have the Willamette River. The Willamette River was superfunded a number of years ago, meaning that it's extremely toxic. If you were to take a cup and scoop the water off the top of the Willamette River and analyzed it for heavy metals and other toxicants, we would see that there's not much in there. However, if we dig down to the bottom where the sludge is and we stir that up and take a sample from there, what we see are very high levels of phthalates, bisphenol A, heavy metals, and dioxin. And so all of these chemicals are toxicants, and they can affect the brain in various ways. So the best way, again, to actually diagnose heavy metals being elevated in your tissues is to take in a chelating agent. And the one that is the most potent for mercury is something called DMPS. DMPS stands for dimercaptopropionic acid. And this is a chelating agent that will pull mercury out of the tissues. So once it does that, it ends up that these heavy metals go into the urine, you urinate them out, and then we can measure them in the urine. So this is called provocative testing. So provocative testing is really the gold standard for evaluating heavy metals. So there's other compounds, toxicants in the environment, and I want to make a note. A toxicant is an environmental toxicant. That means that it comes from human-made, whereas a toxin is something that's biologically made by bacteria or viruses. For example, tetanus produces a toxin, and that toxin can cause a severe condition called lockjaw, which could lead to death. So that's different than a toxicant. Toxicants are man-made or human-made compounds. Another one that we are exposed to in more and more amounts is something called glyphosate. Glyphosate is the active constituent of Roundup Ready. Currently in the world, we spray about 4.5 billion pounds of glyphosate. That's a lot of glyphosate. So glyphosate is something that will kill almost all weeds. But if you genetically modified your crop, such as soy and corn, canola, and cottonseed, then what happens is those plants, the genetically modified ones, survive, and all the rest of the plants, they die. The problem with glyphosate is it's not very specific, and it kills just about everything it comes in contact with. So, for example, one spraying of glyphosate over a field will kill about 50% of all the earthworms in the ground. That's a bad sign. That means that, if it's sprayed more and more times, we're making a soil that's really not very fertile. So, and everything we need to do to make our soil more fertile, we need to do, and that is put back organic matter back into the ground and stop killing things. So glyphosate is something that could be measured in the urine, and we can pick up if you have high levels of glyphosate in your urine and in your tissues. So those are just a couple of tests that we can do. So there are other things that we are creating in our bloodstream that can cause toxicity in the brain. Again, these neurofibrillary tangles are a result of oxidation in the brain. One such compound is called homocysteine. Homocysteine is something that's made from an amino acid, an essential amino acid called methionine. So when the body is deficient in certain nutrients, vitamin B6, B12, and folic acid, what happens is higher levels of homocysteine appear in the bloodstream. So how come you haven't heard about homocysteine in Alzheimer's disease? Well, the reason is there's no drug to treat elevated homocysteine. Homocysteine is treated through the diet and through vitamins, as I mentioned, vitamin B12, folic acid, and vitamin B6. Those three vitamins, though, have to be converted into their active forms. Some people have what's called a genetic methylation defect. This methylation defect results in a vitamin B12 that's not activated and also a folic acid that's not activated. Activated folate is called methyl tetrahydrofolate. Vitamin B12 is called methylcobalamin. And those are the active forms. So we want to make sure we don't have this genetic defect, and we can test you for that defect. And, really, we just want to measure what level of homocysteine that you have. Homocysteine was discovered by a researcher, Kilmer McCulley, back in the 60s and 70s. He was working out of Harvard. They basically kicked him out of Harvard and they said that he was wasting their money. Really, Kilmer McCulley should win a Nobel Prize in medicine for his discovery that homocysteine is a risk factor for dementia, Alzheimer's disease, and cardiovascular disease, as well as osteoporosis, which is also an epidemic in this country. So what other lab tests can you order, can you have your physician run to check to see if you are at a higher risk for developing Alzheimer's disease? So we can check for inflammatory markers. And we've spoken in prior podcasts about iron. Iron is something that we can't live without, but too much of it we can't live with. So what do we know about iron? About 1/5 out of every 15 people carries one of the genes that codes for hemochromatosis. That means that people that are homozygous, well, if they don't donate blood on a regular basis, they will develop severe oxidation of their tissues. And usually they die of fulminant heart disease. So what else aside, how do we measure tissue levels of iron? Well, you can do that from a test called ferritin, but also you want to check something called the percent transferrin saturation. Those two tests combined can give you a good idea of where your tissue levels of iron are. If your level of iron is elevated, you want to get rid of that iron as well as possible. Stop taking any type of iron supplements. Don't use cast iron pots and pans. But really, you want to know, well, what is the ideal level of the percent transferrin saturation? You want to be at least below 40%. As we get above 40%, that means that you have too much iron, unnecessary iron that's causing excessive oxidation. Excessive levels of iron can also lead to blood sugar abnormalities, prediabetes, and eventually diabetes. So you want to diagnose that at an early age if you have elevated levels. Okay, what are some other things that we can check for? One thing is called fibrinogen. Fibrinogen is a particular protein that represents the ability of the blood to clot. When you're experiencing inflammation in the body, fibrinogen levels go up. I like to see fibrinogen levels below 300. So that's the cutoff point. Another test that we can measure inflammation in the body is CRP, C-reactive protein. C-reactive protein is a simple test, and it measures how much inflammation is going on throughout the body. So there's different types of CRP, C-reactive protein, but just generally speaking, you want your levels of CRP to be less than 1. Okay, so now we've covered fibrinogen, CRP, homocysteine, but let's look at really, cardiovascular factors that play a significant role here. So one of the things that we know is that your LDL cholesterol is something that can cause oxidation of your tissues. So LDL cholesterol, we can measure a particular component called LDL particle number. So I like to use this analogy when I'm explaining LDL particle numbers. Normally, we don't like to see LDL cholesterol above 90. Anything above 90 means that we've got work to do. And to do this work, we want to make sure that people are eating a proper diet, which we'll go through in a little bit in terms of Alzheimer's prevention. Okay, so we know that elevated levels of these inflammatory markers will create inflammation. So LDL particle number, if we take the example of, let's say we have a putting green, and on the putting green, there's a fence, chain link fence, and you've got a bunch of kids, and they have tennis balls, golf balls, and marbles. And they're throwing these tennis balls and golf balls and marbles at this fence. And as you know, the tennis balls are going to bounce back. Some of the golf balls will get through and go onto the putting green. And then the marbles, more of the marbles will get onto the putting green. So the groundskeeper comes along and he sweeps those marbles and the golf balls off of the green. So depending upon how much HDL cholesterol you have is a determinant of how well your body's sweeping away those LDL particle numbers. So particle numbers represent the marbles, the smallest of the LDL, and that's what causes the most damage to your blood vessels. Again, sometimes it's very difficult to distinguish between regular dementia and Alzheimer's disease. So I actually treat them very similarly. So one of the things, again, we want to make sure is that your cardiovascular system is optimal. So one test that I recommend pretty much to all my patients is something called CIMT. CIMT stands for carotid intima media thickness. This is a simple ultrasound test where we can measure the thickness of the arterial wall, specifically the carotid arteries, to within 1,000th of a millimeter. That's really tiny. And we can gauge and see how old your blood vessels are versus your chronological age. Ideally, you want to be at least 5, 10, or more years below your age. If you're much higher than that, that means you have a lot of work to do in terms of your cardiovascular system. So CIMT is a critical tool. It's inexpensive and it's low technology. It's a simple ultrasound. And that's not the same as just a regular ultrasound. They can also pick up with the ultrasound any plaques that you might have forming. Plaques can reduce the flow of blood into your brain and therefore cause problems with dementia. So we want to keep a special eye on that. All right, so now we've covered a number of diagnostic features that we can look at. Certainly, we want to check for blood sugar abnormalities. Blood sugar abnormalities play a major role in dementia. So diabetes, it's now estimated that almost half of the population, the adult population in the United States, has either pre-diabetes or diabetes. So we want to make sure that we check fasting insulin. I like to see fasting insulin at least below 7. If you're below 7, that means your insulin's working well. And that's something that we want: less insulin, not more insulin. When people develop prediabetes, usually what happens is the body tries to compensate by making more and more of insulin from the pancreatic beta cells. So we want to make sure that your insulin level is low. And we'll get into, treatment in a few minutes here. But one of the things, of course, fasting is one of the great balances of inflammation and also of blood sugar abnormalities. So one lab test that's an important lab test that most physicians don't even think about is something called TMAO. TMAO stands for trimethylamine N oxide. Where does trimethylamine N oxide come from? Well, it comes from a couple of compounds, one choline and the other carnitine, which come from eggs and animal products. And so what do we know about TMAO? People that have elevated levels of TMAO basically have increased risk of developing cardiovascular disease as well as dementia. So it's an important risk factor that we can check out and see where people are at. So TMAO is produced, as mentioned, from carnitine and also from choline. Choline found in fairly high amounts in eggs. So eggs are controversial with regards to cardiovascular disease, but this is one reason to be very careful about eating too many eggs, because the choline and the carnitine, when they get absorbed, when they get digested in the digestive tract, bacteria in the GI tract will break these compounds down into something called TMA, trimethylamine. Trimethylamine then goes to the liver, and the liver oxidizes it and creates something called TMAO, trimethylamine N oxide. And that is the toxic component that's created by the body. So we know that vegans or fully plant-based diets produce hardly any TMAO. And that's something that will be beneficial in the long run as far as Alzheimer's disease goes. Okay, so we talked about how we're measuring mercury in the urine through provocative testing. So this is something that's done in a doctor's office. So where does all the mercury come from? Well, now that we have routine fires in the summer, one of the things that we know is that coal burning plants, that especially in China, produce a significant amount of toxicants into the air. In fact, 20% of the mercury that exists in the state of Oregon actually comes from China, coal burning plants. So these heavy metals that are produced go up in the air, come down on trees. Once these forest fires get going, that mercury gets liberated into the air, and then we're exposed to more and more. Probably the biggest source, however, is going to be fish. So fish tend to concentrate heavy metals such as mercury in their tissue. So the bigger the fish, the bigger the predatory fish. So sharks, swordfish, tuna, these fish all have significantly high levels of mercury in them. But now even smaller fish are starting to have significant amounts of mercury in there. So we need to be really, really careful. There's a movie called Eating for Tomorrow, and that's a movie that just came out about 2 months ago and talks all about the fish industry. I urge you to read or to check out that documentary because I think it's a really important one. Another important source of mercury comes from amalgams. Those would be fillings that are used to put into cavities. So amalgams, those silver amalgams, are made out of 55% mercury. Every time you chew, drink hot liquids, that mercury, small amounts, tiny amounts, gas off and go into your tissues, some of which goes into your brain. So it's very possible that you could accumulate over your lifetime a significant amount of mercury from these amalgams. So taking those amalgams out requires the skill of a trained dentist, a biological dentist. So I would highly recommend, if you do have a number of silver fillings, which are mercury fillings, seek the advice and the expertise of a biological dentist that knows how to take them out, because you can actually create more problems in trying to remove the fillings if you grind them out and the mercury gases off in high amounts. So I mentioned that your brain is composed of 70% fat. So the type of fat that's in your brain is dependent upon the type of fat that you eat. So one of the things that we know is that omega-3 fatty acids, which everyone has heard about omega-3 fatty acids, especially as related to fish. So omega-3 fatty acids are grossly deficient in the American diet. Normally, what we like to see is a ratio of about 4-to-1 omega-6 to omega-3. In the United States, it's more like 22-to-1 omega-6 to omega-3. So there's a remarkable test that's now made available to the public where you can actually measure in the red blood cells the percentage of omega-3 fatty acids. So this red blood cell measurement is something that gives us a clue as to how much in the way of omega-3 fats that we have in the brain. So why is omega-3 fatty acid, why is that an important fatty acid to have? Omega-3 fatty acids decrease your risk of developing cancer, Alzheimer's disease, cardiovascular disease, autoimmune disease, a number of different chronic diseases. So we want our omega-3 fatty acids to get as high as possible. Problem is, fish, which is the highest source of omega-3 fatty acids, is now contaminated. Contaminated not only with heavy metals, but also with microplastics. So I urge people to be very careful about their fish consumption. Certainly do not consume farmed fish, and don't consume large predatory fish. Smaller fish are going to be better. So a better source of omega-3 fatty acids is actually algae. So problem is most people don't eat very much in the way of algae. But algae is where the fish get their omega-3 fatty acids from. So we should get our omega-3 fats from the source. There's other foods as well that contain omega-3 fatty acids in the plant world. So before we get into them, I want to just say that the average American, their red blood cell membrane, have about 4 to 5% omega-3 fatty acids. In Japan, where they have lower risks of certain types of cancer and cardiovascular disease, their percentage is more like 8%. Ideally, we'd like to see anywhere from 8 to 12% in the way of omega-3 fatty acid percentile. Okay, so what are some sources of foods that we can consume that have omega-3 fatty acids? One, flax seeds have a significant amount of omega-3 fatty acids. Chia seeds also have omega-3 fatty acids. Walnuts, pumpkin seeds, soybeans all contain substantial amounts of omega-3 fatty acids. So any chance we can get more omega-3 fatty acids is a good thing to go after. And so plants, generally speaking, have small amounts of fats, but the fats that they have are usually omega-3 fatty acids. Grains tend to be high in omega-6 fatty acids. They're not necessarily bad fats, but they're just out of balance with the omega-3 fatty acids. So we want to limit our consumption of omega-6 fatty acids and prop up our intake of omega-3 fatty acids. And we can do that. We can measure over a period of time how well your membranes are changing into omega-3 fatty acids. But this is something that I believe is critical in terms of prevention of Alzheimer's disease. And there's a number of books. I'm going to give a shout out to The Alzheimer's Solution by the Scherzais. This was a book that was written a few years ago that talks about diet and supplements and how to prevent Alzheimer's disease. So what are some other things we can do dietarily wise to prevent Alzheimer's disease? One thing that we know is the microbiome plays a major role in inflammation in the body. So one of the ways that we can enhance our microbiome is to eat more and more fiber. I highly recommend the book Fiber Fueled by Will Bulsiewicz that talks about that. And we did another episode about Fiber Fueled in the past. So other things that we can do, aside from cranking up your level of fiber, I usually like to see between 40 and 50 grams at least, but also we want to maximize our phytochemical intake. So phytochemicals are pigments in food that basically prevent oxidation of tissues. So we know that this oxidation can be prevented if we saturate the tissues with antioxidants such as vitamin C, vitamin E, tocotrienols, carotenoids, as well as selenium and other pigments found in foods. So enhancing your intake of as many different phytochemicals as possible is critical to protect the brain. I created a formula called OxyQuench Ultra that concentrates some of these antioxidants, and they also contain several major phytochemicals, carotenoids, which are extremely important at preventing oxidation, as well as milk thistle, which is a potent antioxidant for the liver. Since all toxicants have to go through the liver once they enter into the body and to be detoxified by the liver. So OxyQuench Ultra is a product you can look up on marznutrition.net, and you can check out some of the details of it. So I'd like to give an example of a meal, simple meal that everyone could make that can have a dramatic effect on your health long term. Is a combination of oats and buckwheat. And cream of buckwheat is a little known cereal that can be really quite nutritious. So there are certain flavonoids in buckwheat that are not found in other types of seeds. And these, flavonoids that are found in buckwheat, one of them is rutin. And this has a significant effect as an antioxidant nutrient. In addition, in this particular breakfast, or you could have it for lunch or even dinner, it also has in it some omega-3 fatty acids. It has flax seeds and chia seeds. And oats also have a small amount of omega-3 fatty acids. So combined with the high level of fiber in this meal, over 30 grams of fiber are found in this one small serving of this cereal. You're getting omega-3 fatty acids, you're enhancing your microbiome, and you're getting soluble fiber that has a significant effect at lowering your LDL particle number. Thank you for watching this episode concerning Alzheimer's disease and dementia. I want you to take responsibility and really learn more as much as you can. Try to concentrate your diet, more plants, as much fiber as you can. And so I think that if we move in the correct direction from a diet standpoint, we can have a rather dramatic effect on Alzheimer's disease. In fact, there was a study that just recently came out showing that we can actually reverse some of the signs and symptoms of dementia. So I urge you to study up more. Thanks for watching, and I look forward to seeing you in the next episode of Health Talk from Marz. It's out of this world.